cure diseases in humans and animals. Welcome to Section 4. In this section, we will focus on the global burden of AMR and strategies for containing its spread. We explore the effects of AMR at individual, society, and public health systems and outline some of the collaborative global responses in the fight against AMR. After this section, you shall be able to state the effects of AMR at individual, society, and public health systems. List some of the collaborative global responses in the fight against AMR. AMR is a major threat in animal health and welfare. AMR endangers animal productivity and life as well as food production. AMR threatens food security and safety, and this adversely affects the functioning of human, animal, and plant health systems, and ultimately affects social and economic development. This slide shows the economic and development consequences of AMR using World Bank Group economic simulation tools. In order to have a better understanding of what the slide represents, please study the World Bank report indicated in the reference. The report puts a price tag on AMR's destructive impacts on the global economy from 2017 through 2050 if adequate measures are not taken to contain the AMR threat. The graph shows that in Scenario 1, the base effect of the 2008 to 2009 financial crisis compared to pre crisis growth in 2001 to 2007. Scenario 2, low AMR. All countries will be affected, but the negative impact in low income countries will be higher than in high income countries. Scenario 3, high AMR. The impact of AMR will be similar to Scenario 1, but much more pronounced in low income countries. Conclusion. The World Bank report published in 2017 concludes that without a global response to containment of AMR, the Sustainable Development Goals for 2030, such as ending poverty, ending hunger, ensuring healthy lives, reducing inequality, and revitalizing global development partnerships, are less likely to be achieved. The global response to AMR requires a One Health approach if it has to be effective. One Health is a collaborative, multisectoral, and transdisciplinary approach, working at the local, regional, national, and global levels, with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. Communication, collaboration, and public engagement are necessary for engaging partners and developing strategies to prevent the emergence and spread of resistance, recognizing the gaps that have existed and working to fill them. Strategies and frameworks at global and national levels should be developed by representatives from these fields working together to ensure an integrative approach. Education on AMR at all levels and in all sectors should be the norm. Since addressing the rising threat of AMR requires a holistic and multisectoral One Health approach because antimicrobials used to treat various infectious diseases in animals may be the same or be similar to those used in humans. Resistant bacteria arising either in humans, animals, or the environment may spread from one to the other and from one country to another. AMR does not recognize geographic or human animal borders. The WHO, the Food and Agriculture Organization, FAO, and the World Organization for Animal Health, OIE, speak with one voice and take collective action to minimize the emergence and spread of AMR. The aim of tripartite collaboration on AMR is to ensure that antimicrobial agents continue to be effective and useful to cure diseases in humans and animals, promote prudent and responsible use of antimicrobial agents, ensure global access to medicines of good quality. Since 2012, the FAO, OIE, WHO tripartite has developed a number of documents to guide global response to AMR as seen on this slide. Global Standards for AMR Surveillance in Humans, 2012. Global Antimicrobial Surveillance System, GLASS, established by WHO, 2015. OIE Standards, Guidelines and Resolution on Antimicrobial Resistance and the Use of Antimicrobial Agents, World Organization for Animal Health, 2015. Global Action Plan on Antimicrobial Resistance, WHO, 2015, Regional Antimicrobial Resistance, AMR, Monitoring and Surveillance Guidelines Series, FAO, USAID, Regional Project on AMR in Asia, 2020. Since early 2012, there have been several global initiatives for containment of AMR. These include: in 2012, OIE members adopt international standards on harmonization of national AMR surveillance and monitoring programs, where there is no global standards for AMR surveillance in humans, no platform for sharing of information. At the 68th World Health Assembly in 2015, member states committed to having national action plans, NAPs, in place by May 2017, based on Global Action Plan on Antimicrobial Resistance. In 2015, WHO has established the Global Antimicrobial Surveillance System, GLASS. GLASS has established the global standards for bacterial resistance surveillance in humans and offers a global platform to collect information on countries' progress in strengthening national surveillance systems on antimicrobial resistance. In 2015, the World Assembly of Delegates of OIE adopted a resolution to follow the Global Action Plan and to develop national action plans with respect to the use of antimicrobial agents in animals and to ensure close collaboration with public health officials. At the same year, the 39th Conference of FAO adopted a status report on AMR and a resolution recognizing that AMR poses an increasingly serious threat to public health, sustainable food production, and that an effective response should involve all sectors of government and society. The resolution urges members to develop or strengthen national plans, strategies, and international collaboration for the surveillance, monitoring, and containment of antimicrobial resistance in food, agriculture, and the environment in close coordination with related plans for human health. In May 2015, the World Health Assembly adopted a global action plan on antimicrobial resistance, which outlines 5 key objectives, that is, to improve awareness and understanding of antimicrobial resistance, strengthen the knowledge and evidence base through surveillance and research, reduce the incidence of infection, optimize the use of antimicrobial medicines, develop the economic case for sustainable investment that takes account of the needs of all countries, and increase investment in new medicines, diagnostic tools, vaccines, and other interventions. Since 2015, many countries have developed national action plans in line with the Global Action Plan. All countries are required to develop national action plans, NAPs, for AMR based on these objectives and further develop strategies to implement each of the objectives. As of January 2021, 143 countries have finalized an AMR national action plan that is aligned with the Global Action Plan on AMR. Another 43 countries are in the process of developing their plans. You may follow the links on additional reading resources in the module to access the full library of officially approved NAPs, or see what WHO is doing to support countries with NAP's implementation.
Professor Dave again, let's talk about staph infections.
He knows a lot about the science stuff. Professor Dave explains.
You've probably heard some talk about superbugs in the media, but what's really going on? First, let's talk about Staphylococcus aureus, which is commonly known as staph. These bacteria are typically harmless and commonly found on the skin of many healthy people. However, in certain cases, as we discussed earlier when we talked about opportunistic pathogens, these bacteria can cause serious or even deadly infections. Let's get some more information on these little critters. In the past few decades in particular, a more dangerous form of staph has emerged, which is called methicillin-resistant Staphylococcus aureus, or MRSA. MRSA is resistant to the entire class of beta-lactam antibiotics, which includes methicillin, penicillin, amoxicillin, and oxacillin, all antibiotics you've likely heard of and almost certainly taken in your lifetime. The different types of MRSA infections are split into categories based on where they're acquired. For instance, healthcare acquired MRSA, or HAMRSA, has been documented since the 1960s, particularly in hospitals and other healthcare facilities. Patients with weakened immune systems, recent surgery, or those with medical devices implanted are at higher risk for HAMRSA, and the incidence of these infections has been increasing steadily over time. A second and more alarming type of MRSA infection emerged in the 1990s, called community-acquired MRSA, or CAMRSA. The points of origin for these infections can be more difficult to identify, but are thought to be common in childcare settings, long-term care facilities, athletic settings, or in individuals sharing towels or other objects. These infections often first appear as simple skin infections, but can progress into life-threatening illness. So how do these strains develop, and why do they develop? Zooming into the microscopic level, Staphylococcus aureus is the most virulent and best-known member of the group of gram-positive cocci, Staphylococcus. These bacteria have a capsule that protects their outermost layer, and they produce a slime layer that helps them bind to things like catheters, prosthetic valves, or joints, or grafts. Staph aureus also produce an impressive number of toxins and enzymes that help them trigger immune responses and destroy healthy tissue, truly wreaking havoc in the body. When we first started using penicillin to treat Staph aureus infections in 1941, over 90% of staphylococcal isolates were susceptible to the drug. However, resistance to penicillin developed quickly, partially due to the natural evolution of the bacteria, but accelerated by overuse and inappropriate use of these drugs by humans. Many of these bacteria can produce what's called penicillinase, or beta-lactamase, which easily renders the antibiotic ineffective. Even worse, these beta-lactamase enzymes are commonly found on transmissible plasmids, which can be traded between bacteria, essentially like trading cards. The thing is, bacteria are inherently driven to evolve, and as humans, we're pretty good at helping them do that. The incidence of disease caused by MRSA has increased significantly worldwide, and the bacteria continue to evolve and take on new traits. For instance, in 2002, scientists found the first staph strains to be resistant to vancomycin, which is one of the few last resort treatments against MRSA. Vancomycin-resistant staph strains, or VRSA, are rare for the time being, but health officials fear incidence of these strains will rise. To reduce your risk of MRSA infection, CDC recommends always maintaining good hand and body hygiene, keeping wounds clean and covered, avoiding sharing personal items such as towels, and checking in with your doctor if you think you might have an infection. And in general, always make sure to only take antibiotics when you truly need them, and when you do, take them exactly as instructed. With some smarts and some luck, we can get rid of these little guys within the century. Thanks for watching, guys. Subscribe to my channel for more tutorials. Support me on Patreon so I can keep making content. And as always, feel free to email me, ProfessorDaveExplains@gmail.com.